There we go. All right. Okay, good afternoon. On behalf of the Newark Public Library, welcome to This Is Not the First Time, the 1918 flu pandemic. My name is Tom Ankner. I'm the director of the Charles F. Cummings New Jersey Information Center at the library. Our two guests today are Sandra Moss and George Robb. Sandra W. Moss is a medical doctor, a retired internist, who also has a master's degree in the history of medicine, technology, and the environment. She has written books on the history of medicine in New Jersey, including one on a polio epidemic in Newark in 1916. George Robb is a professor of history at William Paterson University. His most recent book is Ladies of the Ticker, Women in Wall Street from the Gilded Age to the Great Depression. In 2017, he curated an exhibit for the Newark Public Library exploring World War I as experienced by Newarkers, which he is currently developing into yet another book. That's right, George, right?
Yeah.
Okay. George and Sandra, welcome. Thank you for being here today.
Thank you.
So I'll begin with Sandra with just some questions about the 1918 flu and some other pandemics in history. Well, I'll begin with the 1918 flu. I'll ask the questions about the other pandemics later. So Sandra, the 1918 pandemic is often referred to as the Spanish flu. Can you explain the historic background of that term?
The first documented case was actually at a recruiting camp in Kansas in March of 1918. It spread, of course, around the world. By 1918, the world was at war. And England and France and Germany and the United States and Canada all had press censorship, partly to calm the locals down and also partly to not give information to the enemy about the extent of the illness. So it arrived in Spain, didn't start in Spain, but it arrived in Spain inevitably, probably from France. And Spain was a non-combatant. So it became, and there was no press censorship, and they covered the influenza outbreak very thoroughly in the Spanish press. So it became convenient to call it the Spanish flu, which was fine with everybody except the Spanish, who called it the French flu. And that name has stuck. As of a few years ago, the World Health Organization nixed this kind of naming and stigmatizing, like Legionnaire's disease or Zika virus. Zika's a forest in Uganda, but we have it in Brazil. So these are meaningless. And COVID-19 complies with the World Health Organization guidelines, CO for co and VI for virus, D for disease, and 19 for the year 2019 when the first case appeared. But we still say Spanish flu, and if we're in a historical context, I think that's okay to say that.
Okay, all right. So about the 1918 pandemic, there was a very high incidence of flu deaths in young, healthy adults, wasn't there? Why was
Yes.
Yeah.
No, I'm sorry, finish.
Oh, no, why was there?
Well, the normal death charts in an epidemic, the young tend to die because they have poorly developed immune systems, and the elderly tend to die because they have worn out immune systems. But in the influenza epidemic, there was so that's the U-shaped curve. In the influenza epidemic, there was this bump and made it a W-shaped curve. The current theory is related to an exaggerated immune response. Instead of merely the immune system responds by pouring out molecules that are supposed to attack the virus or the bacterium in the case of plague. And in the end, they wind up attacking the normal tissues, probably mostly the lungs in the influenza epidemic. This is called a cytokine storm, which certainly sounds, pretty serious. And there's evidence that this is going on with COVID-19 right now. So it's felt that the reason the young people with their robust immune systems died in their numbers was because of the attack by an overactive immune system.
Okay, I see. Okay. What about the outbreak of 1918 flu in Bristol Bay, Alaska, made it unique?
Well, first of all, the epidemic began in the lower, well, it wasn't a state, but I'm going to say the lower 48. Alaska wasn't a state. In the spring of 1918. It did not reach Alaska until the ice broke up after the winter freeze and the boats could start coming into the harbor. So it started in Alaska in about spring, May of 1919. Bristol Bay is on the coast on the Bering Sea, where the Aleutian Island chain comes into the western coast of Alaska. The local people are called Yupiks. They lived in small communities. it took very little for the disease to spread. It spread like wildfire once the ships started arriving. And the death rate among the Yupiks was enormously high, possibly about 40%. The people who were dealing with the rescue ship and so forth that went up the coast, and they found whole families dead in their small dwelling places. They found children who were orphans at that point sitting amidst the family dead. I won't even go say anything about the dogs and how they dealt with the dead. The dogs had to be shot. Some 300 orphans altogether were brought back to the small town of Dillingham, and an orphanage was built at public expense. And those are some of the children. They were raised in that orphanage. They still live today. Their descendants still live today in Dillingham, which is now exactly almost a century since that outbreak. So that was a devastating event. The governor of Alaska did the best he could. Under winter conditions in Alaska, no help from the lower 48. It was not a state. He put out warnings, but there was really very little that could be done.
It's horrible.
Yeah.
Yeah. So can you talk a little bit about the differing experiences between American Samoa and New Zealand?
Yes. The two parts of Samoa, the New Zealand, now independent Samoa, but then Western Samoa or New Zealand Samoa was, of course, a colony of New Zealand. American Samoa, the government during that period was an American, naval American governor. His name was John Poyer. He received routine wireless messages, not from the government, but just sort of routine wireless messages that there was an epidemic around the Pacific Basin. New Zealand was heavily involved with the epidemic. Based on this, and with absolutely, there he is, without any help whatever from the American government, he decided unilaterally before a single case arrived to establish a vigorous quarantine of American Samoa, something an island, especially if you're an imperialist. And he established a very multifaceted, very vigorous quarantine. He had shore patrols to keep the canoes from New Zealand Samoa from arriving. There were all sorts of measures, and he kept it in effect for almost 2 years. New Zealand Samoa, which also got no help from their government and did not have the advantage of a wonderful governor, did nothing. Within a few days, a ship that had multiple cases of influenza arrived in New Zealand Samoa, was allowed to dock, and within a few weeks, there was a massive outbreak of influenza in New Samoa. At the end of about a year and a half, the influenza, ended, and the deaths in New Zealand Samoa were 20% of the population. They had about 50,000 people, and they had about 8,000 deaths. The death rate in American Samoa was absolutely zero. There were no deaths, and there was only 8,000 people there, but there were 0 deaths. And Poyer, who deserves a lot of credit for this, quoted his successor spoke about Poyer, and his successor said to the Samoan people who cooperated with the shore patrols and so forth, "He saved your lives and the lives of your brothers, your wives, and thanks to his wisdom, you are not bowed down in anguish over the deaths of your children." I thought that was very telling. And I'm not sure what it's an example of. It's an example of one of the few great moments in imperialism, maybe. One could say that. Very few and far between. And I think the story is worth telling.
So, George, your research on the 1918 crisis is primarily on Newark.
Right.
You have some statistics about the disease in the city. Can you talk a little bit about them?
Sure. Okay, so from October through December 1918, so this 3-month period, which is when the epidemic was really at its height, around 29,000 Newarkers came down with influenza. The population of the city was about 430,000 people then. Approximately 2,200 Newarkers died during that period. The first influenza case was reported in Newark on September 27th, 1918. By October 3rd, there were 1,500 cases. On October 4th alone, there were 700 new cases. By October 21st, there were 18,000 cases in Newark, and 750 people had died by then. So the number of new cases in Newark began to decline later in October. The bulk of the city's deaths were in October 1918, about 1,500 people. 400 more people died in November, and around 300 in December. And this pattern was the same in most American cities, where you had 1 or 2 weeks of rapid spread, followed by 2 to 3 weeks of high levels of sickness and death, and then a rapid subsidence. The highest death rate in Newark was among the young and also middle-aged adults. So about 50% of Newark's fatalities were people aged between 25 and 44. You also had a disproportionate number of African Americans who died, had a higher death rate than white people. And at the time, Black Newarkers lived in the city's worst and most overcrowded housing. So social distancing was just something, what we would call social distancing was completely impossible then.
Mm, mm, okay. How did the flu affect the local government's actions in Newark? Did they do to fight the...
Right. So in late September, the Newark Department of Health launched an information campaign, and a pamphlet on the prevention and treatment of influenza was sent to every household in Newark. Also, thousands of posters and placards were distributed and displayed in public places around the city. The public was advised to avoid unnecessary exposure, to dress warmly, and to cover when coughing and sneezing, and to take bed rest and call a physician at the first sign of a cold. School officials and employers were requested to send home any child or worker who appeared to be catching a cold, and the police were instructed to eject coughers and sneezers from places of public assembly. Right. As the epidemic worsened, the governor of New Jersey, Edward Edge, imposed a statewide quarantine on October 7th. Under this order, all schools, churches, theaters, dance halls, saloons, and sports arenas had to be closed. All indoor and outdoor gatherings were prohibited, including for the sale of war bonds. Public vehicles like trolleys had to keep their windows open for ventilation, and they were not allowed to be crowded. I'm not sure how they defined crowded. The quarantine did not apply to restaurants, which were deemed essential businesses, nor were business offices or factories closed. And under wartime production, many factories in Newark operated 24 hours a day for 3 different shifts. So the whole economy is not being closed down like today.
Yeah.
Newark's mayor, Charles Gillen, at first refused to impose the quarantine on Newark. So the governor imposes a quarantine on October 7th, and Gillen says, well, he'll think about it. He's not sure he's going to do it in Newark, which really wasn't his right to do that, but he did it anyway. Gillen was suspicious of quarantines. He thought they were bad for business. He also thought they especially harmed working class and immigrant populations, and that's what was really his constituency. He was himself an Irish immigrant. Gillen suggested that the way to deal with it is that the sick should stay at home, and that anyone who was coughing or sneezing should avoid public places, and that people who were well could just go about their normal lives. Now, the rest of the city government didn't care for this, and they put a lot of pressure on him. So on October 8th, Gillen did impose a quarantine, but it was a modified one. So at first, he didn't close the schools in Newark. Though later he does do that. He also doesn't close. Yeah, so there's a notice in the Newark papers that sort of shows. This was from October 8th, showing what places were closed down. Gillen also doesn't close saloons, and this was very controversial. What he does is he says you can't go into a saloon and order a drink, but you can buy liquor from the side door of bars. So this comes to be called the side door policy. Gillen cited medical authorities that alcohol was helpful for flu and pneumonia. And one of the issues was Gillen was a Democrat, and he was very anti-prohibition. And the governor of New Jersey, Edward Edge, was a Republican and was in favor of temperance and prohibition. So Gillen was suspicious that closing down of saloons was just a way to try to sneak prohibition into Newark. But the Newark newspapers really mocked Gillen for this policy, you know, the churches were closed, but you could still go to bars. And he was called, they called him the side door mayor, and he got really angry. He threatened to close down the newspapers because he said they were interfering with you know, his governance of the city during a crisis. So it was a pretty bad episode. And then on October 21st, Gillen completely opened the quarantine in Newark, and that was a week before the state of New Jersey did.
Oh, okay. So the quarantine didn't really last that long then?
No, it really didn't. It only lasted about 2 weeks.
Oh, okay. Yeah.
But that was during the worst period. So they decided to open the quarantine by the 3rd week or the 4th week of October, because at that point the number of new infections was declining. The number of new cases was declining. But of course, there were a lot of people who were sick, and a lot of people continued to die.
Yeah, of course. How did the flu affect the medical system in Newark?
Well, hospitals were completely overwhelmed, as you can imagine. The city at one point had to convert a warehouse on Broad Street next door to where Haynes department store is today into an emergency hospital with 1,000 beds. The war had already created a shortage of trained medical personnel, since a number of Newark doctors and nurses had volunteered for military service. A number of doctors were brought out of retirement because hospitals were so short-staffed, and also student nurses were pressed into full-time service. Many of Newark's 2,000 school teachers volunteered to work in hospitals. Of course, once the schools were shut down, they were not in work. And also, you had about 200 Roman Catholic nuns in Newark who worked as nurses during the crisis. So I found one incident of a Newark doctor who treated more than 3,000 patients in a 29-day period. And he later commented on this. I'll just, a brief quote from him. He said, "There was no need to make appointments. You walked out of your office in the morning and people grabbed you as you walked down the street. You just kept going from patient to patient until late in the evening." There were no effective treatments. Initially, 30,000 doses of Pfeiffer bacillus vaccine, that was an early influenza vaccine, were distributed in Newark, but they were completely ineffective. And some Newark hospitals also injected patients with a mixture of camphor and oil. I'm not sure what, if anything, that did. Face masks were utilized in 1918, especially by medical personnel, but also by police officers and office workers. Streetcars were disinfected at the end of the day. At Prudential Insurance Company, death claims for influenza that were sent in were disinfected before the workers opened them and looked at them. Of course, what we would call social distancing was very difficult to practice in Newark, especially during the wartime period, which was very overcrowded. The city population increased by 50,000 during the war because there were so many defense plants operating in the city. So a lot of people moved into the city. So housing was even more overcrowded than normally, and especially in poor and immigrant neighborhoods. So just, you know, I'm sure it spread the disease even more.
So in your research, you came across some letters from the Richer family. Can you describe how they shed light on life in Newark?
Yeah, they're a really rich repository. The Richer, I think the Ricker family.
Ricker?
I think Ricker. They lived on Bruce Street. They were a Jewish family. The parents had immigrated from Russia. The father operated a small workshop that made overcoats. In 1918, there were 8 children in the family, from the age of the oldest at 28 and the youngest was 7 years old. And the second oldest son, Jack, was in the Navy. He was serving overseas in the Navy in World War I. And the reason we have all these letters is because his siblings wrote him hundreds of letters about the family life and about things going on in Newark. So there's a lot of interesting information about what's going on in the city and a lot of commentary about the influenza epidemic. By September 30th, 1918, everyone in the family except for the father and the oldest sister had come down with influenza. They were all confined to bed, and they had temperatures ranging from 102 to 104. So basically, it was the sick taking care of the sick. The oldest brother, Israel, almost died. He was hospitalized for 15 days. He developed pneumonia, and he lost 27 pounds. By October 15th, Sister Anna wrote to Jack that everyone in the family was feeling better, but that 6 friends of the family had died. She also reported that the family physician who had attended them during their influenza Dr. Vera Scheckman had just been hospitalized. She referred to her as a lady doctor, but a very good physician. And she never later commented about that. So I wondered whether she survived or not. And I looked her up and found out that sure enough, in the 1940 census, Vera Scheckman was still practicing medicine in Newark. For me, the most interesting part is that the sister Ava, who was only 17 years old, was a student nurse at Beth Israel Hospital in Newark. And the hospital was so understaffed that they pressed her into service, and she was in charge of a whole ward of sick influenza patients. And so she wrote her brother a letter on October 24th about this, and I like to quote from this because I think it's an interesting kind of moment. So she points out that there were 12 beds in the ward that she was in charge of, and that 4 of them were at the moment they were empty. So I'll just read the letter from here. 2 men died yesterday, 1 last night and 1 today. Within the next 12 hours, I expect a little boy of 12 and a big, strong man to pass away also. But they don't all die. They come and go like flies. Within the past 2 weeks, we have sent from our ward about 15 convalescent patients. At present, we all have very sick men here. Of the 8 cases in the ward, all pneumonia, 6 are delirious and keep trying to get out of bed whenever the nurse's back is turned. Therefore, I must keep my eyes open. At present, the ward is rather quiet, except for the rasping coughing of the men. Don't you hear it? The little fellow in the corner bed, the one who's going to die in a few hours, gets out of bed every few minutes with such lightning rapidity that it is astonishing. The poor kid is so weak that no more than he gets on his feet, his knees tremble and he stretches out his hands, groping for some support. Okay. So she ends the letter there because she says she has to stop for the moment and go and give them injections. And in between restraining patients, she was constantly having to give them glasses of water and bedpans. And then when a patient died, the routine was she had to wash the corpse with chloride. She had to wrap the body in a sheet and then bring the body to a morgue on a cart. And she's doing this day in and day out for several weeks. And she's 17 years old. So, pretty amazing.
Yeah, it is pretty amazing. Well, thank you for that. So Sandra, you've done some research on some other pandemics in history, and I wanted to ask you about a few. One of them is about the bubonic plague. Why was it called bubonic plague?
The origin of bubonic is a Greek or Latin word, or maybe Greek and Latin word, bubo. And the hallmark of the disease was massively enlarged lymph glands in the neck and the axilla and the inguinal area. These were the buboes, that's what they were called, and therefore it was bubonic plague. The term Black Death came a little later. The skin around the buboes became dark, and that's probably the origin, though there's been some discussion of possible other origin, but that's why it was called the Black Death. What are other definitions? Quarantine. 40 days, 40 giorno, which I hope there's nobody who actually speaks Italian out there, in the Venetian harbor. That's how long the ships had to stay. And then, of course, the term became generalized. So it wasn't just the 40 days, which was a pretty long time to stay on board a ship infested with rats and heaven knows what. Yeah. Influenza, by the way, probably came from the idea of the influence of the stars or the heavens or whatever. It's related to possibly in Italian, I'm not sure, a word for influence. Just a few words, the organism was identified as a bacterium in 1900 by a Swiss scientist who had studied with Pasteur named Yersin. Initially, he called it Pasteurella pestis. It became Yersinia pestis. It's a bacterium which now is susceptible to antibiotics, but this was all in the pre-antibiotic era, of course. And it's mostly transmitted by rodents. In the case of Europe, it was the rats, though in the Western United States, gophers and other little burrowing things can transmit it. And fleas. Fleas were the mechanism between the rats and humans, but there's a pneumonic form, which infects the lungs. And that is transmissible from person to person. And a lot of what went on may have been secondary infections within families just from respiratory secretions. So this was a pretty fierce disease, to say the least. Pepys, who wrote his famous diary, was a naval administrator in London and in Greenwich. He continued his diary and his very active social life, if I could say so, while his wife was away in London. And but he did say just a few words that I think come down to us. He said, "I stayed in the city till above 6,000 in 1 week died of the plague, and little noise heard day nor night but the tolling of bells." Also, from his point of view, my brewer's house was shut up, my baker with his whole family dead of the plague. If the plague continues among us another year, the Lord knows what will become of us. This is the 1665 plague, the last real big plague to hit London, the so-called Great Plague. And it was the last plague to hit Britain. Apparently Camus' book, The Plague, La Peste, is rolling off the shelves or into the online reading. It's an allegory of the plague in Oran that he discussed, that he invented really, was an allegory of the Nazi invasion of France. But the book stands alone as a history of what plague might have been like in a city, and I would say the 1920s, 1930s. The doctor who's at the heart of the book, Dr. Ryu, remarked that the only means of fighting a plague is common decency. And I think that's one of those things that kind of connects the two illnesses that we're dealing with. Did you want me to talk about EM?
I did. I was going to ask you about that next. Yeah, I'd never heard of that before. And that's been in the news recently in Britain, right?
Yes, EM, which is spelled E-Y-A-M, and I'm possibly pronouncing it correctly, is in Derbyshire, which is sort of north central England. And in 1665, it was a small village with, it's unclear how many people actually lived in, somewhere over 700 people lived in the village. And it was apparently brought in by fleas that were in a bolt of cloth brought by a tailor or somebody who came to the very soon bubonic plague broke out in the village. After several months, some of the families wanted to leave the village, which is understandable. And the minister who's pictured here, William Paterson, who was only 27, I don't know what he was, but 27 when the plague broke out, and his wife, incidentally, was a victim. She died. Gathered the people, or came up with the idea of not spreading the plague village to other regional villages. And the people agreed. They would keep it there. They would die in their numbers as happened, but they would not spread the plague. And what they did was set up boundary stones, these giant rocks, and the neighboring villages would leave food or whatever was necessary. They would put money into holes drilled within the rocks so that to buy the things that they needed. And they kept this up for well over a year. They did not go into the church. For Sunday services, they went into a veil, and the individual families would cluster together. I don't know if it was 6 feet or not, but other families would be in their little clusters in the same veil. So they didn't know about the fleas, really. They didn't know about the rats. They didn't know how it was transmitted. And I think some probably pneumonic plague. In the course of 14 months, depending on sources, somewhere between 250 and 370 people in the village died. In one sad family, a woman buried her husband and all 6 of her children, which she had to dig the graves because families were responsible for their own graves. They couldn't carry the bodies to the cemeteries. When there was no more plague for 2 weeks, no new case, they rang the church bells all day. And as you mentioned, reporters are going there. There's a little plague museum, which is shut down now. They're sheltering in place. They're doing all the things that we're doing. Some of the descendants can trace are still there after 300 or 400 years, which is interesting. The current minister, let's see, Reverend Gilbert, his wife is quite ill, but she's reading, and he has vowed that when the COVID crisis is, will again ring the church bells as they did, I guess, 350 years. I just found the story about Ian, and I guess many other people, I didn't invent this or discover it, really very moving.
Okay. Yeah, with a lot of, it is really moving. I also wanted to ask you about the Asian flu pandemic. It was referred to as the Asian flu pandemic in the 1950s. It
was, indeed, yes, 1957. There was something called flu, which I remember as a child. There were about 1 million global deaths. It was an H2N2, the Spanish flu, I can say that, it's a history session, in 1918 was N1. They found some tissue preserved in the permafrost in Alaska and were able to sequence that. Buddy left who has that virus. I mean, this was an H2N2. There were about 1 million global deaths. And a man named Maurice Hilleman, who was a scientist, Walter Reed Army Institute of Research, said that flu is going to come here. We're going to get it. And he began developing a vaccine. He bypassed the government, which was possible in those days, contacted the pharmaceutical houses, and when the flu hit the United States, as it inevitably would, there were millions, I think it was 4 million vaccines were available. And even though there were deaths in the United States, he probably prevented a great many of them. He went on to develop 30 or 40 different vaccines, including our present DPT and so forth. He's sort of a forgotten figure in medicine, a remarkable scientist. And so that was the Asian flu. The Hong Kong flu was in 1968, 69. So you younger people might remember that. That was an H3N2, and there were 100,000 deaths in the US as well. And then there was a pandemic in 2009, which I don't really recall. I must have been busy with something else. And of course, there's the annual influenza, which does kill a certain number of Americans every year. And that's the Asian flu.
Okay. All right. Well, thank you very much. Now I'm going to open it up to everyone. I'm going to unmute everyone to ask a question. Anybody have any questions? Raise your hand. Or Tim, you had asked a question, right? Tim Christ?
Yeah, for Dr. Moss, it sounded like from the letter that George read from the young Ricker daughter, that most of her patients were men. Did the 1918 flu affect men in a different way than it affected women?
I haven't seen anything on that. It's really possible there was just a women's ward.
Yeah, they would have just segregated the patient. So yeah.
But it's hard to know. Of course, all the military cases were.
I suggest that if you're not talking, you mute until you're ready to talk, because there's so much.
Oh, that's a good idea.
I'll do that. Okay. Now I'll just unmute. Unmute, and unmute. Sorry, I had to mute everybody and then unmute a few people. Okay, there you go. Now we're set. So, Tim, you're done? Okay. So does anybody else have any questions? Raise your hand if you want to. Okay, Carol, I will unmute you.
Thanks. So good to see you, George and Beth. We worked together on an article recently. Lots of emails. But what I was going to ask is, and one of the reasons I was so eager to see this is, did any of you come across anything specifically about how the women's rights, the 19th Amendment work was going on, how the flu affected that, and whether people were grounded for any length of time by the flu?
That's a good question, and that's not something I came across, though I'm sure, like everything was shut down for a couple months, or a lot of public activity was shut down. So it obviously had to have affected people, but I just didn't find any particular reporting about that. But I guess if you go and look for it, you might be able to find something.
Well, I know that I found from Jeanette Rankin in Montana, that when she was running for her running for Senate from Montana in the 1918 campaign, one of the things that affected that was that gatherings were limited to no more than 10 people in Montana.
Right.
But then my understanding was that after that the fall of 1918, we had a resurgence the next year as well. Did that not happen in our area?
It came back, but not in such huge numbers as it had before. So yeah, but I don't have good statistics on that. So Sandra may know more about that. So.
Didn't know if, as you'd been going through the newspapers, you'd seen anything or not.
Yeah, I mean, I saw some, but it wasn't nothing like what it was, in 1918.
So in 1919 and 1920, when they're actually trying to get the ratification, the flu is not affected.
It's not like shutting things down, at least, in a significant way. But, yeah, but it's a good question. So yeah, I'd like to know more about that myself.
If anybody else has any questions, you can type it into the chat box. Eileen, I'll unmute you. Okay.
Well, thank you very much. I'm really just a visitor. I'm with St. Peter's University, but I'm interested because both of my grandmothers were victims of the 1918 pandemic. They were both in their late 20s, just as you've mentioned, healthy, robust women, from what I've been told.
They both died?
They both died. One was from Newark and one was from Nutley. The Nutley one died about a year after from complications. I guess my question is there any evidence or research that says that people who experienced that flu developed an immunity to the flu after that? Or in any way were able to, when there was a surge again, you know, those that came through it, did they have the antibody? Maybe they probably didn't talk about antibodies in those days, but you know, was there any evidence at all that?
If I may,
immunity?
there were different strains. So
They're all different.
No, there were different strains. Yeah. So no, unfortunately not. There was also something called encephalitis lethargica, which was a neurological degenerative disease that seems to have been a late effect of influenza in the movie Awakenings.
Okay.
That Parkinsonian, I can't remember who the actor was. Who was the actor? The Parkinsonian type symptoms. And Oliver Sacks wrote about this. And that was thought to be, but not proven to be, a late sequel of the flu. But in terms of immunity, no, I'm afraid, you know, when the next virus comes down the pike, no.
Thank you very much.
But I'm really sorry about you. I mean, that sounds devastating for the family.
It was.
So Don W., you had a question? Oh, I'm trying to unmute you, sorry. You were, okay, so
Yes.
Don
Yes,
W. was asking,
I did.
oh, there you go, okay.
Okay, well, for Dr. Moss, what treatments might be available today that would have been helpful in 1918? For example, Tamiflu is used to help reduce some symptoms. Do we have anything today that would have been helpful then, specifically?
Well, George mentioned the vaccine that was tried, which was in fact a bacterium, not a virus, a bacterium which was misunderstood to be the cause of flu, called Haemophilus influenza, or the Pfeiffer bacillus. And it still bears that name, Haemophilus influenza. So they did have all these vaccines which were completely ineffective because they were targeting an organism, a virus they didn't know anything about. I'm sure with modern flu, hopefully the vast array of influenza type, Tamiflu and that sort of thing, hopefully would be effective. If there were bacterial complications, we could deal with those today as well, because I'm sure some of the people developed bacterial complications. As you know, the flu vaccine changes every year. It's usually a guess. Apparently the guess this year hasn't been terrific. They just have to guess what strain is going to be most prominent. So the answer is possibly. I have to say, in all honesty, this person is related to me, and he was ordered not to ask any questions that I didn't know the answer to.
You know, I found an interesting, the Newark Health Board were talking about, there was one doctor in Newark who prescribed red onions and coffee. And the health board basically thought he was a bit of a quack, but as they noted, the death rate among his patients was no worse than among anyone else's. And it was basically an admission that nobody knew. There was no effective treatment. And the best thing you could do is tell people to take to bed and stay hydrated and stay fed. And hopefully they'll get over it. If they don't, they're going to die. But none of the things that were tried proved to be at all effective.
Okay, so Lisa Blauvelt, you have a question too. Are you aware of any psychological effects of people who were children during these flus? Anything that, do either of you know anything about that?
You mean like the after, like having
people who were sick as children, any psychological effect that had on them later?
Oh, well, I'm sure a lot of people were traumatized by it.
Sure.
Well, I mean, one of the things that Ava Ricker talked about a lot in her patients is signs of like mental derangement. And again, I don't know anything about the medical aspect of it, that people becoming delirious and acting in very erratic kinds of ways. And her brother Leo, who was 7 years old, when he was affected, writing to her other brother, she said that everybody in the family thought he was loco in the cocoa, right? They thought he had, right, that's a, you know, loco in the coconut, because he got up and he tried to sit on the hot stove, and he took someone else's hat that he thought was, you know, that he was behaving, that they thought he had just lost his mind. It turned out to be a temporary thing. So that apparently was one of the ways it affected people. But well, I'm sure people, you know, whose families died in large numbers were traumatized by this. But as far as whether there have been any studies about this, I don't know anything about that.
Okay. So Dominic Stampone, you have a question too. You would,
yes. Would you like me to ask it?
Yes, yeah, go ahead.
Good afternoon, everyone. Just an amateur New Jersey history buff, and I'm enjoying this program very much.
A lot of books.
Well, that's my office. That's my real office, but I'm not in it.
Okay. Oh, okay.
I'm using it as the fake background. My question is about conspiracy theories. I've come across some very interesting ones about COVID-19, everything from 5G to maybe the public water supply spreading the disease. In 1918, were there any such conspiracy theories? I recall reading something about aspirin or the Bayer Company from that period.
Oh, interesting. I never came across anything like that, but I wasn't exactly looking for that. So I didn't find anything from 1918 about conspiracy theories, although there may have been ones out there. In the bubonic plague in the Middle Ages, people blamed the Jews for it and said Jews were poisoning wells and this was causing it. And so there were some anti-Semitic attacks on Jewish people in Europe at the time. So, I mean, that would be one example much earlier in history. Sandra, are you aware of any conspiracy theories from 1918?
No, but I especially with the war on.
Right.
I'm sure there were, you know, blamed German spies and same thing on the other side, but I haven't seen anything written. But, you know, it's very convenient to blame somebody.
Sure. And the naming as well, like we'll name it, you know, you name the disease after the country that you blame it on, right?
Yeah, the Spanish.
Right. Or syphilis was the English called it the French pox and the French called it the Italian pox. So it was like, you know, everyone blamed another nation for it. Yeah.
Well, I think that's part of the WHO guidelines will help prevent some of that. Ebola, I mean, it's a river in Uganda or someplace. It's really irrelevant to treating and diagnosing the disease.
Thank you.
Okay. Any other, anybody else have any other questions?
Tim had asked a question about where the Ricker family letters, and those are the New Jersey Historical Society, if people are.
Okay. Okay. Yes, Carol, I will unmute you. Yes, Carol, go ahead.
Well, getting back to the question of blame and also conspiracy and everything else, it was pretty dangerous at that point to speak out about anything because of the Espionage and Sedition Acts. So you couldn't get you could get arrested for speech at that point. So that might also have affected at least what appeared in writing. But my other question relating to that is, and I'm not, at what point did the soldiers from Europe start flooding back in, and did they start a second wave? Or was it kind of homegrown when it came back? Do we know anything about that?
Some of it did spread back and forth across the Atlantic with soldiers. Most soldiers didn't get back to the United States after the war until into 1919. Mm-hmm. So by then it had, the worst of it was over. But there certainly were massive outbreaks in military camps because of the concentration of people, and it did spread around that way. So, and soldiers did bring it with them over to Europe. So, yeah.
Do we know what caused it to stop?
I don't know. Sandra might have a better explanation about why that happened.
Whatever it is, I hope it works with COVID. But probably just either the virus attenuated. I mean, influenza stops every year, so either the virus attenuated in some way, or there was just so much herd immunity to this specific virus that either people were dead or recovered or immune.
It burned out to the population so fast. Yeah.
So the first big, just help me again because I'm a little confused. There was a wave in like.
In Newark, it was October really.
There was only one big first? Because other places had 2 or 3 different, right?
Yeah, I mean, it had started other places earlier. It came to Newark in late September. It really burst in October, and it declined in October, and you had some more deaths in November and December, but then it was pretty much over. And it came back in smaller bits after that, but the vast majority of deaths were in October 1918.
Okay.
Yeah. So it was very intense.
Which is probably why Newark got that huge herd immunity if it really went through the entire city at that point.
Yeah.
Okay. So Arnold and Nancy, you have a question.
It wasn't a question so much as just a comment that the building where I work was in the ironbound section was converted during the flu epidemic. It was an orphanage for children whose parents had died in the flu epidemic.
Oh, wow, I didn't know about that. That's
And
interesting.
there might have been, I'm sure there probably were other places in Newark that took those orphan kids. That's something we could probably find out more.
Sorry about that.
Yeah, I would be interested to know more about that. I mean, people may know the novelist Mary McCarthy. Both of her parents died in 1918 in the influenza epidemic, and she was brought up by her grandparents. So, there are lots of cases of influenza orphans.
Yeah.
She's
And
her grandfather, famous one.
The grandfather.
The other thing that's interesting is that Newark had a lot of epidemics of other kinds of diseases before the flu epidemic. They had cholera, they had yellow fever, they had, tuberculosis. They had a lot of different.
Polio. Sandra's written about polio in Newark.
It was a 1916 epidemic of polio in the eastern United States. Newark per capita was the hardest hit city in the United States. And I've studied that to some extent. New York, of course, had more cases, but per capita, for unknown reasons, Newark was the hardest hit city. So the polio epidemic was devastating. There was 600 or 700 children left with various degrees of paralysis. The children who were badly affected just died. There were no iron lungs. Tuberculosis was not so much epidemics. Tuberculosis was endemic. It was always there. It was a major disease until antibiotics became available down in New Jersey, I should say, and some of the other diseases that you mentioned. The yellow fever. I'm not sure when yellow fever occurred in Newark, but that was also more toward the in the south. But yeah, you're right. There's always something, and polio was indeed devastating.
Do you have, Sandra? Do you have a theory about why the polio was so?
No.
Okay.
Some cities were spared. There's no reason, really. Of course, Newark had intense connections with Brooklyn, which is where it started. The public health director in Newark alerted the public health director, Craster, who was involved in the influenza epidemic in Newark, to be ready. And they were as ready as they could be. But there was no treatment. There was isolation. There were quarantines. There were hospitals. There was really nothing that could be done. And many of the children just died. And many were left with, bracing and so forth. But I can't think of any reason why it would be special in Newark.
Mm-hmm.
So we have one more question from Joshua Christie.
Hi, good afternoon, everyone. My name is Joshua Christie. I'm a student at Rutgers, Newark. With my professor, Tom McCabe. He actually recommended me to this session, and it's a really great session. And I had a question about the responsiveness of the mayor of Newark at the time during this epidemic, with the pandemic rather, because you see, like, the response of a leader has a lot to do with how things like this affect the city. You see with Italy, with the United States, and different countries. So I want to see how the responsiveness of the mayor of Newark at the time was versus today's mayor.
Right. Well, the mayor at the time didn't like the idea of a quarantine, so he was very resistant to having a quarantine. And when the governor imposed a quarantine, he said Newark wasn't going to do it, and then later he said Newark would, but he made exceptions in Newark. He ended the quarantine early in Newark because he thought it was bad for business. So he was criticized for that, and really what he was doing was illegal, because the governor has the right to impose a quarantine on the state, and the city can't really opt out, but he did it anyway. And I mean, the governor could have like sent in the National Guard to impose it more strictly, but it might have been more trouble than it was worth. Some of the other members of the city council even considered deposing the mayor or taking his power away from him at the moment, but they didn't do that. So, and you can see that some of that squabbling today, where some governors want to end the shutdown faster, and then some big city mayors in those states, like think of Georgia, where the mayors want to have a more rigorous kind of shutdown. So the thing between Mayor Gillen of Newark and the governor of New Jersey back in 19 was similar, except it was quite exceptional because there were no other mayors in New Jersey who resisted the quarantine or kind of quarreled with the governor the way the mayor of Newark did. So he was a disagreeable kind of person. I mean, you know, because then when the newspapers criticized him, he threatened to shut down the newspapers, which of course he didn't have the authority to do, but he was, you know, he was maybe trying to invoke wartime powers or something like that. So it was, but it lasted, the worst part of it lasted a few weeks, so then it blew over. Had the crisis lasted longer, it might have had to resolve itself in a different way. But yeah, it's a good question. Thanks, Tom, for having you guys do this. Did you take a history of Newark class with McCabe, Professor McCabe? Yeah.
All right, well, thank you very much. That's our program for today. Thank you, Sandra and George, for sharing your expertise. And
Thanks everybody for tuning in.
And thank you everyone else for taking part. I have a couple of other programs next week that might interest you. On Wednesday, I will be talking with economist Dan O'Flaherty about how census data has affected Newark over the last several decades. We will try to clarify why it is important to fill out your census forms. That will take place via Zoom next Wednesday at 1 p.m. On Friday, May 8th, also at 1 p.m., also on Zoom, we will be marking the 75th anniversary of VE Day by talking with two scholars of World War II and New Jersey. Patricia Chapin of Stockton University will be discussing her book, New Jersey Women in World War II, and Joseph G. Bilby will be sharing the World War II anecdotes of New Jersey service members from his book, New Jersey, A Military History. And next Wednesday at 7 p.m. on Facebook Live, we will be presenting a one-man show by Jesse Bernstein, whose grandfather was the personal physician of Newark gangster Longies Willman in 19... That sounds fun. I've actually seen it already. He did it on Facebook Live somewhere else. It was a great little show. Ethics of the Fathers, AKA The Gangster and Grandpa, is Bernstein's personal exploration of ethics, his Jewish identity, and his relationship with his grandfather. There's more information about all of these programs on the Newark Public Library's website, npl.org. Stay safe, everyone, and thank you.
Thanks,
Thank
Tom.
you, everyone.
Thanks. Bye, everyone.
Bye. Okay, so we can end meeting. Yep.